Hi everyone, welcome. It's Rowena Explorez, Parenting Without Manual, and today we're going to be talking about mental health disorder in children and how we can identify it, help them, support them, what support we can get. My guest is Dr. Liane Nelson, Chief Psychologist and Director of Trauma Program at Westchester Jewish Community Services, which is a non-for-profit agency that deals with individuals who has mental health issues.
Hi, Ro.
Hello, hi, Dr. Nelson.
Oh, call me Liane, my friend.
Oh, hi, Liane. How are you?
I'm fine on this gorgeous Sunday.
Yes,
So
I know, right?
all right, should I just jump right in and
Yes,
start talking?
yes,
Okay.
yes. I know you are with the trauma program, and your niche is resilience.
That's right. That's right.
Right.
So before we get started, yes, thank you, Rowena, for the wonderful introduction. I am the chief psychologist and I'm the director of the trauma program at WJCS in Westchester. I am also a mother. My kids are, I have a daughter who's 28 and a son who's 26. No grandchildren yet. But I love talking to parents. I love talking about children. I run the trauma program and I have trauma clinicians in all 4 WJCS offices. So we have offices in Peekskill, Hartsdale, Yonkers, and Mount Vernon. And parents are such a huge part of our work because I work personally with children, adolescents, and adults. So getting into this conversation, so yes, thank you for highlighting resilience. Resilience is so important. And before I ever talk about poor mental health or trauma, it's important to remind everyone that most of us are resilient. Most of us have strengths inside ourselves and within our communities, and most of us can bounce back from bad situations and even trauma by leaning into ourselves, our people, and our community. So I want to tell you about, there are 3 things about resilience. One is and we're talking about resilient children in particular.
Right.
So one is what children bring within themselves to a situation that can allow them to bounce back from hardship. So some examples of these are, how well can your child handle their emotions? How good are their social skills? Can they calm themselves down when they get upset? These kinds of things can help children bounce back from hardship. The other is, we say, external factors. So that's what's around the child. That's what surrounds the child. So how safe are your schools? How good are the schools that your children attend? How safe is your community? Does your child have access to good food? I know that there are things that we call food deserts, especially in densely populated urban areas where people don't have grocery stores that are accessible that they can get to easily. Do families have enough money to live? Is the quality of the education good enough? Is the family a loving one? These are things that can also help children bounce back from hardship. Mm-hmm. The last one is the most important thing when we talk about resilient children, and that's having at least one safe and protective adult. And I'm sure the people on this call have had that experience of being that safe, protective adult for children. When I talk about this, I always like to talk about the example of my father. My father passed away a number of years ago at 89. He lived a long and beautiful life. But when he was a child, he grew up in extreme poverty. And his father died. His father passed away when he was 5. And then his mother basically abandoned him when he was 11. So here he was, 11 years old. He ended up getting a job as a bellhop in a hotel in exchange for room and board. And he was able to put himself through high school and through college and through graduate school. But he says that he never would have been able to have accomplished any of those things if it wasn't for his older brother, Joe. Joe was about 10 years older than him. And Joe was that safe, protective adult for my dad. And my dad and I used to talk. He was also a psychologist, and we used to talk about resilience in children. And he just really felt that that was so powerful for him and his story, and powerful for children. And I also, I have worked, as I said, I've worked with children and adolescents myself. And one of my other favorite examples of this is there's a young woman I worked with a number of years ago, and then she went on to have a career in the Navy. And she'll send me an email every so often, say, "Hi, Miss Liane, just want to let you know, where I am and what I'm doing." And I just really, I just feel so honored that this beautiful young woman has retained a connection to me in her life. That's just really an honor. So the best way this is when it's a conversation. So if anybody has any questions, and I want people to feel free to jump in and ask. But I'd also like to sort of set the stage for where we are today. We seem to be coming out of a 3-year pandemic. COVID is still around, but it doesn't necessarily carry the same danger that it did, especially in that first year when the doctors didn't really know how to help people who were sick before they really knew how to treat it. And we went into lockdown fairly quickly. I don't know if anyone remembers that we were told that it might last 2 weeks. So 3 years later, here we are. And the importance of that is that it impacted all of us.
Yes.
The parents who could shifted to working from home. Parents who couldn't, who had to go to work, did the best they could. I know my 26-year-old son sells chocolate to grocery stores across the state of Connecticut, and he's been in those grocery stores since the beginning of the pandemic, since March of 2020. So the additional stress and worry that caused for people who had to go out into public, especially in the beginning of the pandemic when we didn't know what we were dealing with. And then worrying about coming home and taking off, his clothes and showering and masks. And in the beginning, we were advised not to wear masks. I think that was because there was concern that our medical professionals wouldn't have enough. But it was really hard and really chaotic. And then we want to look at what happened for our parents and children. Parents who could work from home then also had to help their children do remote school. Right. And everybody was in the same 4 walls, or, sharing the same space. I know I worked with a woman who was, had to do her job from home and also help her 9-year-old son manage his school. And I remember having Zooms with her, and she would have to mute herself anytime she wasn't talking because her son's teacher was speaking really loudly, and her son had some attention issues. So it was really chaotic and really hard. Yes. Children lost their connection to their teachers and their schools. And I think it was hard for many of our children to have a benefit from remote school. It impacted their ability to see their friends. Right. And because of this and other reasons, I think that we call this a collective trauma because it happened to all of us, regardless of our circumstance. Yes. But there's also been a pandemic of racial incidents of racism. And I think it's really important to mention that, especially when we talk about the impact on our children, on our Black and brown children in particular, where we've seen people being harmed for doing ordinary things like going to the store, buying Skittles, driving, that's a big one, relaxing at home. And I think it's made people feel extra scared, and our kids, I really worry about this impact on our kids. Social media has changed this. Obviously, racial violence it's not new, But I think one of the things that did change was our awareness of it, like as a country. I was old enough to remember when Mr. Rodney King was beaten in LA, and somebody was able to take a video of that. And the same thing happened when Mr. Floyd was killed in Minneapolis. The Minneapolis Police Department said it was a medical incident until Ms. Darnella Frazier videoed, unfortunately, all those 9 minutes and 29 seconds of it. So the whole thing, I think we just have to really name it and own it. It makes me so sad that we don't think of all children as our own children, and that we can't look for ways to keep them all safe and protected. I think of the example of Jesus, and I think, what would Jesus want us to do to protect our children and for us to feel responsible for all children? So I think that these two collective traumas have really had a bad impact on our kids, our children, and our adolescents. The first year of the pandemic, we saw rates of self-injury, and we saw rates of suicide attempts and eating disorders increase. And a lot more children were showing up in emergency rooms and in hospitals. Now, I'll talk about this a little bit later, but I just want to say, since I brought it up, that self-injury it's not the same thing as suicidality. The two things are different. It doesn't necessarily make a lot of sense, but many people hurt themselves on purpose to feel better. It's either because they feel too little, they feel so numb, and they feel just hollow, and they want to feel something, or they feel completely overwhelmed, and it's a way of bringing down their feeling of overwhelm. But we'll talk about this a little bit later. And then also eating disorders. Why did eating disorders increase? Well, I think one of the things is that children used to have a more predictable schedule for meals, but during the pandemic, the kitchen was nearby, and some kids coped by eating too much. Sometimes children eat too much as a way of comforting themselves, and other children ate less or even stopped eating. And sometimes with eating disorders, it can be about control. For example, a kid might feel, I can't see any of my friends in person. I'm worried about my parents. There's so much of this experience that I can't control. But I can control how much I eat, or when I eat, or if I don't eat. So again, I think most people are resilient. But this is the impact of collective trauma. Collective trauma is the kind of trauma that we all experience together, regardless of our circumstance. So I think it's important to name that. So I've just talked for a lot of minutes.
Well, it's good information. Yes.
Thank you. And if anybody needs anything to be clarified, or if I say anything that doesn't make sense, please ask.
Yes, I will let you know as soon as I see anything pops up on the live. I will let you know. But continue. If not, I have some questions for you. But let me know when you're ready.
Yes, I sure am ready.
Hold on a second. Hi everyone. Welcome to my live. Hi, I'm here with Dr. Liane Nelson, who is the Chief Psychologist and Director of Trauma Program at Westchester Jewish Community Services, which is a non-for-profit agency in Westchester, New York, that deals with individuals who have mental health issues. So she's here. I wanted to bring her on live where you could see her, but we had technical difficulties and I couldn't bring her on. So we're doing the next best thing. We're talking to her on the phone. If you have any comments, any questions, you can put it in the comment section and I will ask her and she'll answer. So welcome to my live. As you come on, I'll wave to you and just to acknowledge that I see you and I know you're there. So welcome again and we'll continue. Okay, Dr. Nelson, you can continue.
Yes. Okay. So, Rowena, I think your first question was,
yes,
what are common symptoms of bad mental health in children?
Yes.
Is that right? Okay.
Yes.
All right. So, I'd say that the biggest difference between normal behavior, like all kids will be obnoxious or rigid or difficult at times. Like that's just normal. That's normal kid behavior, right?
Yeah.
I think the difference between normal behavior and poor mental health is when it affects the child's ability to be successful in their relationships, to be successful at school, to be able to, feel like they have some ability to do things. If a child isn't seeing a positive impact and it doesn't feel like they have the ability to get what they need and what they want, that is often a problem. Mm-hmm. There has to be a poor impact somewhere to be a mental health concern. Okay. So, like, if a kid is acting obnoxious and the parent spells out why they're on punishment and the child can pull it together eventually, that's normal. If the child can't pull it together eventually, that's more likely a problem. Mm. And in general, here are some examples of things that might be a problem in children. Children who are sad, that continues past the situation that made them sad, or if there's no clear connection to a sad event. Or like an example would be, say, a child's grandmother passes away. It's normal. We expect, we love the grandmother, and so we're all going to feel sad about it. Mm-hmm. But if the child stays really, really, really sad and really focused on grandma's passing, like over, weeks and weeks and maybe even months, that might be an indication that there's a problem.
Okay.
Another would be anxiety that makes the child feel stuck, like they can't do what they need to do in their lives, or if they look like they're just covered in anxiety. Aggressive behavior that isn't helped by structure and limits. I really feel strongly that children want structure and they want limits. They want to please their adults usually, right?
Yes.
And so they want to know what is expected of them. And I think it can make children really anxious if they're not really sure what's expected of them. So I think that, clear sort of rules and guidelines are important. A child who seems scared all the time, that might be trauma. It might be anxiety.
Okay.
A child who's afraid of adults, that might indicate a problem. A child who's afraid to go to school or daycare. Now that can be, usually with children, that can be for a couple of different reasons. Sometimes we see children who really feel like they have to stay home and protect their parent. And I'll talk about an example of that in a little bit. And sometimes children are afraid to go to school or daycare because there's something wrong there, maybe. Another example would be a child who can't sit still or continually runs around and around and around. And adults who love this child have a hard time helping him or her stay in control. And where this becomes a problem is that it's really hard to have good peer relationships. Sometimes, like, your friends won't really want to be around you if you're so impulsive and you're constantly moving around and stuff like that, So those are just some examples of some.
Okay. I've seen quite a few of that too, but I want to ask a question, like, how can some of the things that you've discussed as signs or symptoms, but how can I differentiate between a typical behavior and the potential mental health concerns? If a child don't want to go to school and opposed to something happen and they don't want to go to school, how can I tell or differentiate if it's a mental health issue or is just typical behavior?
Yeah, that's a great question because, above, all, as I just said, all children will be obnoxious or annoying or rigid or won't listen. Sometimes that's normal behavior. But if it goes on and the parent or caregiver can't help the child switch things up, that might be where there's a worry. So let me talk about some typical child development stages. So with preschoolers or young children, they're kind of funny because they're trying to figure out the world, and a lot of the time what they do is they want help and they want to be left alone. So a lot of times you'll hear, I need help, I can do it myself. I need help, I can do it myself. Because they're trying to figure out how to have an impact on the world and just how to be people, right? They want to be independent and they need the security of their adults at the same time. Right. The other thing is little kids really want to be helpful. and they really want praise. I was just in Oakland a couple weeks ago with my nephew Darius. He's 5. And I said to Darius, you are my most favorite little boy in the entire world, and you should just see. And every now and then he'd come back to me like I was there for 4 or 5 days, and he'd say, Aunt Anna, am I still your favorite boy in the whole world? I'm like, yes, Darius, you are my most favorite little boy in the entire world. So they want to be helpful, they want praise, they want to please the people in their lives.
Yes.
And I also tell parents it's kind of funny and kind of similar with preteens and young adolescents. Sometimes I say that like 2, 3, and 4 are really similar to 12, 13, and 14 because they're also trying to be independent. And they also want help, and then they also want to be left alone. So they'll say the same thing at those ages that they'll say when they're younger. I need your help. I can do it myself.
Yes.
So, yeah. So every kid is going to feel insecure at times. That's normal, especially during preteen and adolescent years.
Okay.
I mean, that's just the way that stage of life is. And it can be really painful to see that as a parent because we want our kids to feel good about themselves. But there's a certain amount of that insecurity, which, I think it's made worse totally by social media. I mean, I think our Surgeon General just came out with some recommendations about social media. And in part because, kids who are on social media, they see everybody living these fabulous and amazing lives that aren't the whole picture.
Right.
People don't post the stuff when they're upset or don't, or sleep deprived or fighting with their, with their brother or sister. They don't post that stuff. They only post the beautiful stuff.
Yes.
So social media can be really a problem. If a child's insecurity is leading them to not want to do things, especially things that they usually enjoy, then that might be a warning sign or a sign that maybe your child might benefit from some help.
Yes.
The other thing is, it is important. I mean, I feel like being a parent is such a juggling act at times because it's really important to let your child figure out some things for themselves because all kids like to learn how to master difficult things, have something difficult, whether, it's a problem that needs to be solved or a situation, and to learn that they can handle it, they can do it on their own. That makes all of us feel good about ourselves, right? If there's something that's kind of makes us scary or anxious, and then we figure out how to deal with it.
Yes. So
on the one hand, we don't want to protect our children too much, but sometimes that's really hard, especially when the world feels dangerous. So if we don't let them and help them figure out how to be independent and when and take some chances, they're not going to learn that they can take care of themselves and learn that they're capable. But all of this is within reason. So again, I was in Oakland a few weeks ago, and Darius is 5 and his sister Ada is 8, and there's a corner store about 2 blocks from the house, and my niece has just started going to the store to buy an item or two for my sister. And she's so excited. She feels like such a big girl, when she goes down to the store to get milk for mom.
Okay.
Or whatever it is, right?
Yes.
And her school is about 6 blocks away. And she walks to school, and she walks to school, and then she walks home with 2 of her friends who are her age. And she seems to be really proud of herself and really pleased. It's kind of, it's more grown up, that she's getting more independence as she's getting older. Now, there's a show on TV. I don't remember what it's called. It's Japanese, and it shows these very, very little children, like 2 and 3-year-olds, going to the store by themselves. Now, that seems kind of excessive, and I think it is. Yeah. But you can see how, you can see how those little kids, how happy they are when they come home. Yes,
they are. They are. Yeah, right? Yes.
They feel very, like
they accomplished something.
They accomplished something. Exactly, Rowena. But on the other hand, the world has changed a lot too.
Yes.
I'm a 56-year-old woman. I grew up in Minneapolis, and in Minneapolis, everybody takes the bus. Okay. And so my best friend Eric and I went downtown by ourselves, and we were about 6. And I remember that it was a dime. It cost 10 cents to ride the bus. Mm-hmm. And we had done it a lot of times before with our moms and our sisters. So we knew, you get on the bus and where you put your dime, and then you go and you sit down, and then you pull the cord when you want to get off, and
Right.
So we went on the bus to downtown Minneapolis. We went to a department store. We went to the toy department, and we went to Burger King, and then we went back to the bus stop and went home.
Okay.
But I don't think that would be seen as normal in this day and age.
Back then it was. Now it's not. You don't even want your child to walk out the street by him or herself because of how the society is now. But back then it was normal. We used to walk to school. When you have those kids, they call them the latchkey kids or something like that. They used to come home, open the door, come inside the house. It's like things have changed so much.
Yep. My husband was a latchkey kid. His parents divorced when he was 7, something like that. Anyway, and so he was a latchkey kid. His mom was a single mom, and she worked full time, and he would get himself home from school and unlock the door and take care of dinner for himself and for his little sister. It was just it was a little bit different.
Yeah.
There was a really interesting study comparing Latino children and their moms with children born in the United States and their moms. So children who were born, I think it was possibly Mexican children and moms compared to American children and moms. Mm-hmm. And what they learned is that Latina children or the Mexican children are taught how to do chores. And their mothers actually take the time to teach them. Mm-hmm. So they tend to do a lot more chores around the house when they're older.
Yes.
Far more than American children.
Right.
So what they discovered is that the American moms tend to be like, it'll be a lot quicker if I just do it. Mm-hmm. But I think, there's so many demands and pressures on parents and on children. So I'm not like trying to say, anybody's doing anything wrong. But I think that we do shortchange our children with that attitude. Like, it's easier, faster for me to do it myself.
I have a comment from one of our watcher. He said in the Chinese culture is different from ours because they train their children to be independent at an early age. So that's so
true. Mm-hmm. That's so true, Mr. Smith. I mean, absolutely, cultures are completely different in terms of what is emphasized in terms of raising children. That's a really good point. Mm-hmm. I see Ms. Nicholson also said, how will we know social media is affecting our children negatively? Mm-hmm. Well, I think that also speaks to the beauty of where it can happen and having conversations with our kids. I remember my 28-year-old, she was probably I think she was in 6th grade at the time when my husband and I got her a phone. Of course, it was a flip phone. It wasn't a smartphone. But I remember her sort of letting slip that there were some mean girls who were inviting her to do things, and then when she would say yes, then they'd be like, yeah, psych, never mind, we're just kidding. I know that when my kids were teenagers, one of the things that I loved doing was giving them rides. Now sometimes that can be kind of a pain because mom's not a taxi driver, but it would stun me how much they would say when they were in the back seat, my children and their friends, and I'd just be like listening and taking notes. But I think I'm not sure if there's a way to figure out how social media is affecting our kids negatively without a conversation about it. Although certainly you can also see, and I think we probably all know kids who are on their computers or on their iPads or on their devices like way a lot, and that's also difficult too with the fact that school was remote. I know I run a group for teenagers, and during the pandemic we didn't have any in-person meetings, like in the first year of it, and there would be these kids and they would be clearly playing games on their computers and thinking that they were so sly that I couldn't see the reflection in their glasses of the games they were playing. So I think that really blurred the boundaries a whole lot. And I know that there are a lot of kids who will say, oh, I'm just doing homework on the computer, but then if the parent does go and look or check the history or whatever on the computer, then they're like, oh, actually no.
They would hide those tabs behind, like minimize them. So when someone walks by, they just press that minimize button so you won't see what they're doing in the back end.
Yeah, exactly. So it's really hard being a parent in this day and age. I just have to say that I have so much respect and admiration for all parents who are able to function any kind of way that's effective with their kids in this day and age, because there's so much coming at us. I mean, the change is just even in 10 years. are stunning.
Mm-hmm. Yes, and that's one of the reasons why I called the segment that I do parenting without handbook, because there's no rules. I mean, people get the information from um, research. Maybe they went to school, or they have the experience from another child, or culturally, or we have these things to go by, but there's no manual as one shoe fits all, or anything like that. We just go by what we think is right for our individual child, because one child, it could work for one child, and then another one, you have to use a total different strategy with the other child. So I just said it's parenting without handbook, and we learn from each other, and we each one teach one kind of thing. So I'm so happy you're here, with talking to us now in regards to this issue. I have another question for you.
Yeah.
Okay. Are there any specific risk factors that increase the likelihood of mental health problems in children?
It's a great question. And I have a lot of thoughts about it. I'll
Okay.
try not to do too much soapboxing, but I think unfortunately our society is not designed to help parents in certain ways. We don't have broad access to childcare, to high quality childcare, and that is the single most important way to help keep kids safe, to reduce the stress on their parents, and to get the kids out of the house, especially if the parents work and childcare is too expensive or difficult to figure out.
Expensive.
I feel strongly about that. I also feel like we treat poverty as if it's a choice. And if a family doesn't have safe and secure housing and enough money to live, the entire family is going to be stressed out, and that might make the child feel stressed out. And this is one of the places where I see some problems. It's important not to spend a whole lot of time looking for the answers to childhood stress in the child if it's the system around them that's stressed out.
Right, the environment.
Yeah, exactly. So if a child and her parents or her mother are living in a shelter, for example, and the child comes to school really tired, you can waste a lot of time wondering, why is that child so tired? And you can waste the parents' time by trying to give them tips about good sleep practices if they live in a noisy, chaotic environment where it might be really hard to feel safe enough to sleep. I guess that's something that I see, not necessarily just in the schools. I see it across the board. Instead of asking, what's the matter with that child? Ask instead, what happened to that child?
Right.
So this is hugely important. So I'm going to say it again. Instead of asking, what is the matter with the child? Ask, what has happened to that child?
Okay.
Because we also know that childhood trauma is one of the biggest drivers of poor mental health in children and also in adults. So if someone's in an environment where they're unsafe, it's normal to feel anxious and depressed and stressed out. And that's one of the other things that I do when I work with my trauma survivors, whether they're children or teenagers or adults, is I say, your reactions are a normal reaction to a completely abnormal thing, a completely abnormal event. I really do feel that strongly. I feel like trauma reactions, sometimes people are like, ooh, those are weird, or oh, those, that person's kind of nuts, or whatever it is. I'm like, no, their reactions are normal.
Right.
If you're in a situation that's unsafe, it's normal to feel anxious. You have to be on alert. You have to be hypervigilant.
Yes.
Like that's just the way it is. And so I define trauma as things that happen that take away safety and control and predictability. There are a lot of definitions of trauma out there, and some of them are just a lot of words. I mean, they're good words, but
Yes.
but for me, this is the simplest and the clearest definition of trauma. That which takes away safety, takes away control, and takes away predictability. And one of the reasons why I like this definition so much is because it makes really clear what needs to be put back into the life of a trauma survivor, whether they're a child, an adolescent, or an adult.
Okay.
I work with a young who was quite severely abused as a child, and we were talking about how she really thought that she was, in her words, she really thought she was dumb when she was a little girl because she couldn't learn how to read. And so she got put in special classes and so on and so forth, and she really got the message, like, you're not very smart. But what no one realized was that her mother was being severely beaten by her father on the daily. And this little girl was so stressed by this, she really just had a hard time paying attention to the teachers. in school. And
Yes.
she told me that she would think about where her mother was during the mornings and during the afternoons when she was supposed to be in school, and whether or not her mother was safe. And it was just really hard to concentrate.
Yeah.
And being abused or exposed to trauma can also cause depression. I mean, that's another thing that's kind of heartbreaking, is that kids will blame themselves for all kinds of things, even when it makes no sense to the adults, because kids are made that way.
Yes.
You know, sometimes kids will think, if I can be good, then it'll stop. And then when that doesn't work, they think like, oh, maybe I need to be good in a different way. Or they look for other things they can try and control so they get a different outcome. But the truth is the one who's doing the hurting is responsible. You know, children are not responsible for the abuse that they experience. And sometimes we see kids who are being abused or have been abused, and it seems like they're asking for punishment. And I just would like to say that if you're a little kid and an adult is hurting you, sometimes the only thing you control is the timing. Another thing that I'd like to say that's a little bit of a soapbox for me is that I wished that we could take all that time and all that money and all that media attention that we spent as a society on educating people about stranger danger, because the truth of the matter is, and you know, we treat about 250 children every year in the trauma program, about 250 children and 250 adults. And I would just say that probably 90 to 95% of all abuse happens with somebody who's well known to the child and the family.
Exactly.
Yeah. So I wish we could take all that time and money and attention and shift it to a different kind of public service announcement and really tell people, if your child says something bad happened to them, believe them. You know, I mean, I think it's just really hard because there's so many reasons why we as a society don't want to really acknowledge the fact that sometimes children get hurt and they get abused. And it's, you know, because it's tragic and people like kind of don't want to think that way. The other thing that we do that I think is a real disservice to children is we expect, well, it goes across the board, it's also adults, but we expect children, if somebody harms them, to fight back and to yell and scream and holler and get away and stuff like that. And the truth of the matter is that most children and most all of us freeze. You know, we just freeze and we just hope that it ends. So I'm sorry if that was like upsetting for anybody who's on this call, but I just want to say, like, we have all these expectations for people that I think are just not realistic. And yes, and Mr. Smith, absolutely, a dysfunctional family can cause the child to act out. Absolutely, 100%. 100%. I mean, I think we also see that sometimes with some teenagers who run away from home. You know, that's always kind of my question. It's like, is there something in particular you're running away from? Because sometimes those children can end up in the juvenile justice system, and that I find heartbreaking, when a child is running away from home for survival purposes. And then the system looks at them as being, you know, incorrigible or unruly or, you know, whatever. And then a lot of times it's the juvenile justice system, and I just think that's tragic.
Yes, it is. It definitely is tragic when it happens like that. So with that said, what can parents and caregivers do to promote positive mental health in children? What can we do as parents and caregivers?
Another great question. There are a few things that I think. One is, as we talked about, being a safe and protective adult and how important that is for children. And giving children a safe place to talk. And, you know, sometimes I think as parents, sometimes we get kind of intense and we're like, oh, you know, Bubba, what happened? You know, what happened to this? What happened to that? And like a lot of times, like, kids just shut down, right? So I think that sometimes if where we can and if possible, and recognizing parenting is really, really a hard job, is to kind of like mind our own reactions first. You know, like I try to, where possible, you know, just kind of have like more of a curious, low-key approach, you know, like, you know, I wonder what's up with this situation, you know, can we talk about it for a minute, you know? I just kind of try to dial back my own intensity, even if I feel intense about it, you know, and if I feel intense about it, then I just need to take a minute just to like calm myself down.
Sometimes it's the way they approach the situation, and the tone used.
Yeah, exactly. I like to use the analogy of like what happens if our child like cuts themselves pretty badly. Like we know if we go like, oh my gosh,
Yes.
oh my gosh, oh my gosh, when we freak out, then what's going to happen to the child? The child's going to freak out, right?
Yes. We have this
So
thing where like when the child falls and you just look away and they don't scream or anything, they'll get up and run back. But once you scream out like, oh my gosh, then they freak out and start to cry. But I've seen where you look away and like they just get up, brush themselves off and run off. So it does reflect, it does bounce back at you when you make that scream or that shout out to them, they react to what you say or what you do.
Exactly. Exactly. So a good example. Oh, yeah. So a good example was for me with my dad when I was a kid. I remember one time I cut myself pretty badly. I think I was I don't know. I was trying to put my bike in the garage, and our garage was always a mess. It was always too full of stuff. And I think the fender sliced my knee. And I went to my dad, and he's like, "Oh," and he like grabbed something to like apply pressure. He's like, "Look at your blood. Your blood is a really nice, good red color. That means you have a lot of oxygen in your blood." He's like going on and on, and I'm like, I don't know how old I was, like 6 or something, and I'm looking down and I'm listening to him. You know, if he had said like, "Oh no, oh my gosh, we got to get you to the emergency room right away," I probably would have been like crying, and hollering, and stuff like that. So I think it's kind of similar sometimes when it comes to emotional topics too.
Yes.
I also want to acknowledge Mr. Smith's comment, money is being allocated for programs like this for children, but it doesn't end up in the Black community, and you are 100% correct. I was just reading an article in the Boston Globe this morning about how millions and millions of dollars have been allocated to improve, the physical infrastructure of schools in the Boston area, but the majority of the money is going to richer white schools as opposed to schools that have more African American, Black and brown children. So you're absolutely right. I mean, if I can just have a little teeny soapbox here, I feel like our legacy and the fact that our country was built on slavery is a trauma and an injury that we have never been able to acknowledge. And we've never been able to deal with it as a society. And the stuff right now politically is just a mess. I mean, I think the idea that we don't educate our children about the legacy of slavery because some white children might get their feelings hurt. I don't even know what to do with that. But I feel like slavery has been a huge trauma. It wasn't just, I know I'm preaching to the choir, but it wasn't just something that happened 4 years ago. It continues, and it just changes and shape shifts and evolves and just continues. On and on and on. I think part of the reason is because we have been unable to have an honest conversation about it as a country. So it's like a hidden trauma. And, a lot of times people want to deal with trauma by pretending it doesn't exist or, just pull yourself up by your bootstraps or whatever stuff it is. And it continues to be a national tragedy. And it shows up in all kinds of different ways.
Yes.
So thank you for that comment. And what if a child has a good family home and a well-protected family, yet that child is suffering? As a comment from Mr. Samuels. How would you differentiate it? I think it really has to do. Well, that's a good question. I have a couple thoughts. So our system of mental health rests upon diagnosis. You have to have a diagnosis in order for insurance to pay for treatment. And so you may know that there's this thing called the DSM-5. It's kind of like the Bible of psychiatric disorders. And the DSM-5 says for every single thing that it has to cause problems. There has to be an impairment somewhere.
Right.
But I do think that, so sometimes that can be a really narrow focus, but I do think in general, if a mental health problem is impacting a child's ability to do what they need to do as a child, which is go to school, get reasonable enough grades, have friends, have, positive enough relationships with their family, with their neighbors, with their community, with their church members, all those sorts of things, if they're not able to rise to the occasion and do those kinds of things, and it's not because of a specific problem that you are able to talk to them about, if they have a particular problem in one of those places, that's because of something, because of somebody who is abusive or unpleasant or whatever it is. But that's a really great question. I think I have a little bit later, I want to talk about some recommendations from the National Institute for Health. Mm-hmm. So with your permission, then let me just jump back sort of quickly to what can parents or caregivers do to promote positive mental health. Right. The other thing are coping skills and teaching your children coping skills. I think that's really helpful.
Yes.
I wonder if anybody has any particular favorite coping skills. The other thing, too, that I like to tell people is, don't try to teach your child a coping skill that doesn't help, that you can't do yourself. And that might sound kind of crazy and obvious, but I will say that as a psychologist, yes, there are sometimes when there's a list of positive coping skills, and I think oh, can I help the kids I work with these ones? But if they don't work for me, I'm not going to be able to teach it very well.
Right.
So sometimes, you can teach your child oh, you know what, Gus, I saw you getting really upset, in this situation here. And, one of the things that helps me calm down, for example, could be sometimes I will count to 10.
Yes.
And so then I'll sit with either my child when they were littler or sit with a child I work with. And, this is how I do it. Another thing that we use a lot with our kids in the trauma program is we teach them this breathing technique that I think is not too complicated. And it involves, what we tell the kids is we say, breathe in the flowers and blow out the candles. So it's a breathing technique where you inhale through the nose, which is breathing in the flowers. And then you do a long, slow, steady exhale. Basically, you breathe out twice as long as you breathed in. And I just say to kids, imagine you have a ton of birthday candles on your birthday cake.
Oh,
and
wow.
Then you'd have to blow out nice and slow and smooth and steady to blow them all out.
Yeah, that's a good one. Mm-hmm.
Yeah. I think also physical activity, that seems to be something that is becoming more and more neglected and ignored in schools. I think that, when I was a kid, I don't know, when I was a preschooler, I went to this preschool and they had a gym with tricycles in it. I think they just sent all of us 3- and 4-year-olds into this gym and just ride tricycles for an hour. I know that organized sports, now that's a whole other thing that's just really exploded in our country. But having enough time for kids to go to gym, during elementary school and when they're in preschool, that can be really hard. And going outside and kids being kids and being able to, do big movements, because we ask them to do a lot of, fine motor skills in school, and we also ask them to sit still and pay attention for a really, really, really long time without, I think, necessarily recognizing that children really need to be able to run around and move physically.
Exactly. So how can I approach a conversation about mental health with my child?
That is a really good question. I think one of the ways, I just had a conversation with some parents of a child who had been abused by one of his best friends on Friday morning. And the thing, I want to sort of circle back to the point that I made about how children will blame themselves for all kinds of things. Things that will have us adults be shaking our heads and I can't understand why that child would think that this was their fault. But one of the things that we do when we work with trauma survivors is we really try to reduce the shame. Because the shame is what makes people feel isolated. It makes them feel like they're the only one who had this experience. So one of the things that I do is sometimes I will talk about a lot of kids have this thing that happens to them, and I wonder if this kind of thing has ever happened to you, to help children understand that they're part of a larger group. They're not the only one who had this experience, whether it was being humiliated by a teacher or, whatever kind of thing. So sometimes I will use that kind of language and talk about, this happens to other kids. I wonder if this has ever happened to you. And again, going back to our conversation about calming yourself down, before you try to have a conversation with your kid, so that we can be kind of low-key about it. There is, there are a couple of other things that I would love to say about this, and I would actually like to come back to this one, if you're okay with it, because I do want to have a conversation, even a brief one, about parents of older kids, and whether or not, how do you talk to them, or how do you ask them about whether or not they've ever felt suicidal, because that, unfortunately, has been kind of an epidemic here. But let me just jump back to a couple of other things. Sometimes when you sit down and you talk to your kids, or try to talk to your kids about what's going on with them, sometimes there's a solution, and that's great. Like if you can help them figure out the reason why they're feeling stress and anxiety, if possible, because if you can help them figure out the why, then maybe the two of you can come up with a solution. Sometimes there isn't an easy solution, or sometimes there isn't really a solution. But I think a child, similar to an adult, likes to feel heard and seen and understood. So sometimes just being able to be, that safe, protective adult who's just like, that's really, really hard, and I'm sorry you're going through that, that kind of thing. If they're littler, and this is one of the things that drives me kind of nuts, is when parents of young children want to talk to their little kids about, like, why did you do this, or why did you do that, or why are you thinking, and like all kinds of words and all kinds of discussions. If they're hungry or tired, put them to bed or feed them. Because sometimes it drives me nuts, especially when parents of younger children are like, oh, why did you say, why, and I'm like, your child needs a nap. Maybe you just want to stop the words and just put them to sleep. Or if they're hungry, just feed them. Like, no more, not so many words. My daughter had a bedtime until she was like 16, and she was outraged about it. And she'd say, I'm the only one I know with a bedtime. But I knew as her mother that if she stayed up past 10 o'clock, she'd get depressed and start to feel kind of hopeless. So I would just say, you got to go to sleep. And she'd wake up in the morning all good to go if she got enough sleep. But, I feel like sometimes, like, it certainly didn't make me a very popular mother to tell my 16-year-old child, you have to go to sleep. But I just would see, it's not a pattern. And then she'd want to have a conversation about it, be like 10:30, why she was so depressed and why life was hopeless. And I'd just be like, oh, sweetie, you got to go to sleep. Because she's just somebody, she's still, to this day, she's 28 years old, she's still somebody, if she stays up late, then her mental health is going to tank. So she just, now she's, she's a grown woman, and so now she knows that she's got to do that. So there's just no point in talking to a tired child or a hungry child. Their brains can't engage.
Okay.
I think there's like a couple more questions, Rowena. I wonder if I should, one of your great questions, you had such great questions, was how can I help my child build resilience and cope with challenges?
Right.
And it really helps if your child knows how to identify how they're feeling. So normal child development is children, when they're young, they usually know the big three. We call the big three mad, sad, and glad. And usually as children get older and develop, and especially if they have an adult who talks to them about feelings, they can learn the more complicated ones, like feeling disappointed or feeling jealous, or even something like feeling nostalgic. It helps if your child can learn how to calm themselves down, like we've talked about. Usually this involves the parent or caregiver teaching them.
Yes.
And again, don't try and teach a skill that doesn't work for you, because it'll probably be too hard.
Okay.
And also to be open to their ideas about what might make them feel calmer or feel better,
Yes.
Making sure, again, that they know that they have people who love them and care for them. And make sure that they have at least one safe, helpful adult. And I'd say the more the merrier. And I see this sometimes. I've actually seen this within my own family, especially in families where there's been a bad divorce or separation or something. Sometimes families will get territorial and want only their side of the family to be important to the child. And if there's abuse, then you don't want your child to be exposed to abuse. They can't be exposed to abusive people. But sometimes it's more about the adults and their feelings than it is about the kids if people are getting kind of territorial.
Yes.
And it's not always easy, but I do truly believe that the more people who love your children, the better. You know what I mean? Like
the village.
The more, the village.
Takes a village kind of thing.
from village, exactly. Mr. Sam has also asked a question about policing and mental health. Do the health facility and the police work together on approaching someone with a mental disorder? Well, that is such an important question, and it's been part of what we've been trying to talk about as a country, but not having great results. So I can tell you that about 14 years ago, something like that. Anyway, my trauma program partnered with the domestic violence division of the White Plains Police Department, and it was a really good collaboration. We did that with them for a number of years, and I think that we recognize that there are. I always say about everything that 20% of the people cause 80% of the problems, and I believe that's true whether we're talking about people, parents, police, whatever it is. But I think that most of the police officers, and this was a detective unit that we worked with and collaborated with, they really wanted the help because they're not trained on how to intervene effectively with people who are having mental health crises. And we've just seen the deadly and tragic impact of police being the ones to respond to somebody who's having a mental health crisis, because usually it gets escalated. Instead of approaching somebody who, I have to tell you, I talk about this with my team, and I also talk about this when I do talks. How many people are terrified or afraid, and then they mask it by being angry? And I think that's really important. I think it especially happens for men because anger is a more positive emotion than fear. Yes. And I think that sometimes anger feels more powerful to the person than just saying, I'm terrified. But that's usually what's happening with somebody who's having a mental health crisis, is usually they're terrified for a number of different reasons. And if you can approach them in, again, sort of a low-key way, and this is something, my first career was, I worked in a maximum security facility for people who had pled guilty to major crimes by reason of insanity. And people were so freaked out. I'm like, how can you work with these people? I was like, the thing of it is that if you lead with respect, usually what you get is respect back. And when you're dealing with somebody who's terrified, even if they're yelling and hollering and carrying on, usually just trying to, speak in sort of a normal, kind of quiet voice, and reassuring them, I'm not here to hurt you, and I want to help. So, same kind of low-key approach. You know what? Can I sit next to you? Can we have a conversation about what's going on? Is so much more effective than going into situations where everybody's terrified, including the police. And then they're much more likely to respond with violence. We have not figured this problem out as a country, and I think it's really sad. A lot of the conversations about increasing mental health, the ability for mental health providers to respond and beefing up the money for crisis team intervention as opposed to police intervention. I think that it's really unfortunate that the language of defunding the police. Like I knew what they were talking about when we were talking about defunding police, but it just got so politicized. There are some really, really nice collaborations with mental health. With mobile crisis teams in Westchester, working in collaboration with police departments that I think is much more effective.
Okay. Yeah. Wait, before you go, I don't know if people could see the little picture I had printed before. This is Dr. Liane.
Yeah, I did.
So you can put a face to the voice. That's what she looks like. She looks much better now. This was a long time picture. But that's what she looked like, guys. Yes. Yes. That's what you have up there. So that's what I got down. So just put in a face to the voice, guys. So that's her, since she's not able to come on live, so you could see her on camera. So that's her. All right. So back to programming.
Yeah. How are we doing on time? Because I know I'm talking a whole lot.
We're good. I mean, okay. It's all on you. It's how your time is, Dr. Nelson.
Okay. All right, so let me go back to another great question is, can you recommend practices or activities that support a child's well-being? I would say being connected to other people and helping children learn how to cope and get them moving if possible, physically moving. And it's so interesting, Mr. Smith, too, because I was just going to say, keeping things positive. Some parents will tear down their children's mental health with constant criticism and anger and name calling, and that is so damaging. It's so damaging. I'm always kind of shocked when parents really believe that they're building their children up by insulting them and calling them names and hurting them. What I hear sometimes is, I'm toughening them up for the world. I don't think that that's possible. You can't toughen up your child for the world by tearing them down. The only way that I know how to do that is to build them up.
Yes.
And to give them positive messages. And you are important and you are capable. And I really like you. Just those kinds of things. Kind of like I was talking about my nephew Darius, saying when I was in Oakland around him like a few weeks ago, and I told him that you're my most favorite little boy in the entire world, because it's true. And you just see his face light up. Those are the kinds of messages that children need.
Exactly.
I love you and I believe in you and I'm so happy to be around you. Those are much more powerful.
Exactly.
The National Institute for Health has a list of things that they list for when it might be appropriate to seek help for a child's mental health. So let me just talk about this for a bit. So they say young children may benefit from an evaluation and treatment if they have frequent tantrums or are intensely irritable much of the time. The other thing, too, I want to say about this, too, is sometimes this stuff is physical as well. Like, there can be a physical problem going on, or there can be, some kind of allergic reaction can cause some of these things, or a physical reaction, too. So I would just say broadly an evaluation and treatment. So if they have frequent tantrums or are intensely irritable, if they often talk about fears or worries, if they complain about frequent stomach aches or headaches with no known medical cause, if they're in constant motion and can't sit quietly except for when they're watching videos or playing video games, if they sleep too much or they sleep too little, or if they have frequent nightmares or seem sleepy during the day, if they're not interested in playing with other kids or they have a hard time making friends, if they're struggling academically or have a recent decline in grades, and usually it has to be kind of dramatic for that. Repeat actions or check things many times out of fear that something bad might happen. And then older children and adolescents may benefit from an evaluation and treatment if they have lost interest in things that they used to enjoy, they have really low energy, they sleep too much or too little, or they seem sleepy during the day. If they're spending more and more time alone and avoiding social activities with friends or family, if they're dieting or exercising excessively or afraid of gaining weight, if they're engaging in self-harm behaviors such as cutting or burning their skin, if they're smoking, drinking, or using drugs, if they're engaging in risky or destructive behavior alone or with friends, if they have thoughts of suicide, if they have periods of highly elevated energy and activity and require much less sleep than usual, that is what we think of as being manic. And if they say that they think someone is trying to control their mind, or that they hear things that other people can't hear. Now, that's another thing, too. That's another one of my soapboxes. The truth of the matter is that every single person is going to hear their name being called when there's nobody there. That's completely normal. And there's a lot of reasons why, people might hear voices that have nothing to do with being psychotic. But in this country, we tend to see that as being psychotic. The truth of the matter is that psychosis is much more accurately described as when people kind of don't make sense, or if they have like really kind of elaborate ideas, about being surveilled. There's surveillance all over our society right now, but unusual surveillance. Like I know that the mailman is coming in and implanting devices in my apartment or whatever. That's more unusual.
Yes.
Yeah. If your child is really sad or really anxious or is having a really hard time with their friends, and you can't figure out what to do to help them, it's good to ask. And I would say that if it's possible, ask people you already know and trust. If you have those people,
Correct.
Not everything needs to be like go to the go to the emergency room right away. If you can, ask a pediatrician.
Mm-hmm.
I would say you don't need to go immediately to a professional unless you're worried about your child's safety or you're running out of solutions and things aren't improving. For parents of older kids, and if they're really sad, you can feel like you should ask them about whether or not they've ever felt suicidal or like hurting themselves.
Yes.
We used to worry that somehow that asking the question would put the ideas in their heads. But the truth is right now we're in a crisis of mental health for kids and teenagers, and the rates of kids who are feeling suicidal or thinking about being
Yes.
suicidal, thinking about suicide is really high.
Mm-hmm.
Again, try not to overreact if your kid says yes. If your kid says they used to feel that way, but they don't feel that way now, you can ask them, well, what changed?
Okay.
If a kid says they thought about suicide 2 years ago because they heard of someone dying by suicide and they thought about it in a moment that might be the answer, but they haven't thought about it since, that's way less dangerous than a kid who says, yes, I thought about it last week.
Okay.
If you're worried about your child's safety, I know in Westchester anyway, then I would say if you're worried about their safety, then I would call a crisis team or bring them to the emergency room. Those are the fastest ways to get help.
Okay. Very, very interesting. Those are really good pointers to look out for, and not taking them for granted.
Yeah, so some people share their trauma with their children because they're still confused about how to love. Yeah. Denise, that's one of the things that's really important that we talk about in the trauma program is intergenerational trauma and what happens, especially if trauma goes unspoken or unhelped, and how that can have a really strong impact on children. Because sometimes people who have been abused, I think what you're saying is that they don't have good boundaries about what to share with their children or what not to share with their children. And one of the things that we see, I think it's in part because children have a natural impulse to want to protect their adults. Sometimes in families where there's intergenerational trauma, then we'll see the children think that it's their job to take care of the adults. Sometimes that natural hierarchy of the children, of the adults being the ones, the parents being the ones to take care of the children, sometimes that gets flipped.
Yes.
It's really, really hard. It's really hard. I think also when parents have their own trauma and they haven't had an ability to talk about it or to another human being or to deal with it, then they just get so confused about what's normal parenting and what's not. There was a mother that I worked with, and it can go from one extreme to the other. Sometimes we see parents who are really like way hyper vigilant, and then sometimes it goes all the way to the other end of seeing parents who are really too lax, and sometimes will put their children in dangerous situations without even seeming to be aware of it. There was a mother I worked with who had her own child abuse history, and so she said something about how like her daughters were, I think, 8 and 10, and she said, I'd never let them go outside. And I said, oh, do you have a yard? And she said, yeah, I have a yard. I said, oh, okay. So is there not a fence around the yard? She's like, no, there's a fence. So I'm thinking like a little short fence or a picket fence or a split rail or something. And I asked her, I said, so what kind of fence do you have? A 10-foot stockade fence around her yard. And she was afraid to let her daughters go out and play in the yard.
Because she put up all those protective barriers, yet she didn't want to allow herself to send the children out. That's like...
Right. That's hardcore. Yeah. And I was like, oh, okay.
She's suffering trauma herself.
Yeah, exactly. That's one kind of trauma response. And then, it can go all the way to, parents just not really having any ideas about or any sense about how to keep their children safe and putting them in situations where they might be harmed. Yeah, so we can go, yeah. Well, I think we probably can go on and talk. Rowena, if you ever want to ask me to come back.
Yes, I would love for you to come back. We have to figure out how to get you on the camera. We will figure it out. Trust me, we'll figure this out, because I'm happy I have you as my go-to person. It's very...
I'm so honored.
Yes, all that you've talked about is very important to us as parents, caregivers, or just being around children, and I really appreciate all the information you gave us. It was well. We hear you, and I know whoever asked questions, they got their answers, and I can't wait for you to come back. We really appreciate you being here.
Oh, thank you. I really appreciate the
Yes.
honor of being asked, and
Yes.
thank you so much, Miss Nicholson and Miss D, my friend from WJCS, who I miss, who has retired, but I miss seeing your beautiful face at headquarters when I go to headquarters. So, thank you so much to everybody. I really appreciate the conversation and the engagement, and
Yes,
I hope everybody
yes.
has a beautiful rest of this Memorial Day weekend.
I have a last question for you. Are there any resource or organizations you recommend for parents seeking additional support or information about children mental health?
That's a really good question. That's a great question. Matter of fact, I was on the internet earlier and I was looking around and I was surprised how many are tied to buying things. I was like, oh my Lord. I can tell you that the National Child Traumatic Stress Network is my go-to resource for anything involving helping children deal with trauma or, scary stuff that happens in our society, natural disasters or mass shootings or, all of these things. I think they're a really great resource. They have excellent information and resources for parents.
Yes.
And for little kids, I think the 0 to 3 network is pretty good too. But I would actually be curious about if there's any resources that anybody who's on here has that they would like to share.
Okay. You people who are watching, do you have any resources or organizations you would like to share with the audience? Is there anyone? I know we're all in different areas, because we're here in New York, and some people, I don't know where you guys are listening or watching from. Maybe you have a different resource or organization you want to highlight?
Yeah, that's the beauty of doing stuff like this in person. It's one of my favorite things when I go and talk to people is, finding out from the audience, because I know that there's a wealth of information and the people on this call have, but maybe not necessarily about resources, but yeah, the National Child Traumatic Stress Network is a really good website, excellent website. And thank you. Thank you, my friend.
Thank you for everything. Oh my gosh, this is so much to digest, and you guys could come back and listen to the live again once I post it. You can watch it over. If you missed anything, you can rewind, fast forward, whatever you want to do when I put it up for you guys to see. You can share with others so they too can hear or see what they missed, valuable information, but they'll have it to their disposal. So thank you all for watching. Thank you, Dr. Liane Nelson.
Thank you, my friend Rowena, and thank you for this really valuable service, and I really appreciate you. And take good care and enjoy the rest of this beautiful weekend.
Thank you so much.
Okay. Bye-bye.
Bye. Thanks. Okay, everyone, there goes Dr. Nelson. She's a very smart lady. As I said before, she's the chief psychologist at Westchester Jewish Community. Thank you so much. I really appreciate your questions, your comments, your feedback on this live. It makes it a good discussion. I can't wait to see you guys again next week, Sunday. This is Rowena Explorez signing off. Bye, guys. Enjoy the rest of your evening. Take care. Toodaloo. Remember, laugh out loud. Bye. Bye.